Every day there is an infant being born. The same can be said of an adult dying. It is rather balanced, but occasionally there is a need to control population in some countries. This leads to infanticide. More specifically, this leads to female infanticide. Infanticide is the deliberate killing of a child, fetus, or infant. The rate of infanticide varies greatly by country. This presentation will compare India and the United States in terms of culture, religion, and policies to understand the difference in rate of female infanticide.
India legalized abortion in 1971, and shortly after the 1980s sex selection, also known as female infanticide, became popular. In 1994, India banned selecting for the sex of your child, but it was never truly enforced until the 2000s. Even today, private clinics still perform such abortions off the books, or families turn to black markets for sonograms and abortions.
As someone who was born in India and who has experienced the culture firsthand, I think this was an important topic to explore. I'm so thankful that my family didn't give in to the societal pressures that idealize male children. In the US, the support for pro life and abortion bans is increasing. For example, the governors of North Dakota, Arkansas, Kentucky, Iowa, and Mississippi have signed fetal heartbeat bills into law. These bills ban abortion as soon as 6 weeks into pregnancy. This stance is based on the culture of religious majorities in the United States. I think it's important to understand how a difference in culture can affect sex ratios. While India and the United States have a different cultural belief, there is still a ripple effect being created in population demographics.
The sex ratio at birth is the number of boys born per 100 girls. In 2012, the sex ratio at birth in India was 110. In the United States, it was 104.7. This doesn't seem like such a large difference, but put it into perspective, the female population of the United States is 50.8%, but in India it's 48.19%.
Countries with a higher sex ratio at birth can be characterized as patriarchal, and in such societies there is economic, political, social, and cultural domination of women. This includes male control of and access to important forms of property, inheritance rights, control of leadership and decision-making in both the public and private domains, solidarity among male kin, a dowry system that requires heavy expenditures for the marriage of a daughter but not for a son, and religious and philosophical systems that elevate maleness to a level of purity and power.
One possible policy recommendation is to reduce opportunities to commit female infanticide or neglect the care of female children during illness. During childhood, female children can receive less health care and less food, which may result in higher mortality and morbidity. The government could appoint community health workers that would check in with families that have expecting mothers as well as families with young daughters. The community health workers would have the resources to report any violations in human rights or negligent behavior. Rather giving fines or sentencing, the community health workers would be a point of access to economic relief policy and education campaigns that encourage families to invest time in their daughters' health and education. Economic relief policy could include tax relief for families with female children, as well as food and healthcare programs that provide discounted or free goods and services to families with female children.
Why can't they just see that boys and girls are the same and can do the same things? This is the question Dr. Utpal Sanasara set out to answer when he went to India, but the truth was not so simple. He conducted qualitative interviews with families that had chosen to have or were deciding whether or not to get sex-selective abortion. Overwhelmingly, he discovered that those families loved their daughters, unborn, born, or only hypothetical. They loved all their children, but something was still causing them to undertake the procedure. They all repeated the notion that they needed to have sons for the economic prosperity of their families. Simply put, having female children was not cost-effective.
Families in India explored the cost benefit of having female and male children and ultimately found that they must have male children for the prosperities of their families. This is a direct example of social exchange theory because these families are participating in a rewarding behavior and minimizing the monetary and emotional costs associated with marrying their daughters away. This explains why families prefer to have male children because the parents can gain a lot of economic benefits as they get older.
Supplementing the monetary and economic loss of having female children will go a long way to elevating their status and balancing the cost benefit of having either male or female children and balancing the sex ratio in India.